Okay, hello, welcome back. So this is my second video about eye surgery in the Czech Republic. So if you've watched the first video, I had an upper and a lower eyelid on both eyes, but on this side, when they started to do the liposuction to get the fat away, there was no anaesthetic, so I refused to let them do this side. So anyway, I've been back with a different surgeon and I've had the liposuction done on this side. So I've got makeup on now, but if you want to see the results without makeup, that'll be at the end of the video. So at the moment, I'm in the bathroom with an artificial light. So hopefully you can see the effects of the artificial light. I'll go back outside again in a minute. But so that's after 10 days. Now you probably can still see there is a little bit of swelling, but I'm going out now and I think it looks absolutely fine to go out. So I'll go in the garden outside and you can have a look at the daylight results. Okay, so I'm outside now, but it's not very sunny, but hopefully you can see in the daylight the results. I'll try and go close up so you can see. I mean, I've not put camouflage makeup on, just ordinary makeup and a bit of concealer, but I think it looks okay. And coming up now is before the operation, a bit of footage, and also every day for the first 7 days. Then when I took the steri strips off, and now is day 10. So I'm quite happy with the result for that, and the price obviously is much cheaper than in the UK. Okay, if you've got any questions, leave them below and I'll try and do my best to answer them. But thanks for watching and hope you enjoy. It's not too gory this time, so don't worry. Thanks. Okay, let's see. Okay, so this piece of fat is what they're going to take out today, hopefully. So they haven't taken out this bit here, little bit there they haven't taken, and they're not going to take this little bit, but they're going to take that bit there, which hopefully should make a difference. I don't know if you can see the scars. That might be too bright. It's quite bright in this hotel. Okay, hopefully use some anaesthetic this time. Okay, so operation's done now. Didn't hurt. Could feel it like pulling a little bit, but otherwise not too bad. Got an ice pack to put on now. Hopefully I'm going to go now, set off. So I probably had it done about 20 minutes ago. Half an hour, no problem. Got a couple of steri strips on there as well. Okay. Okay, so this is just a quick video of the day after the procedure. So it's gone a little bit pink, and I don't know if you can tell, but it is quite swollen. Doesn't hurt at all. And then I've got a couple of steri strips on there. So I slept fine last night, no pain, doesn't ache. But I think this is going to be kind of bruising maybe. It's going to obviously possibly get a bit worse over the next couple of days. But it's not hot or anything. I had the ice pack on it last night. And if you can pick up that, I'm trying to get it in a good light, pick up the swelling. Okay, so I'll do another film tomorrow. Okay, so now it's day 2, and I think the bruising has gone darker, but I do think the swelling has gone down a little bit. Doesn't hurt again, no problem. So I'm just going to put a bit of concealer on that so that when we go out people can't see. And these steri strips are stuck on fine. It's going down a bit, so it's looking good. Quite pleased. Right, I'll let you know tomorrow. Okay, so it's day 3 now, and I think the bruising's going a little bit darker at the bottom, but the swelling's really reduced, just in the middle, maybe a little bit of swelling. And I can put some concealer on that and make it look a little bit better for going out. But yeah, it doesn't hurt. Quite pleased. Okay, let you know how it is tomorrow. Okay, so here I am on the plane, and because I'd got up really early and it was dark, we were in a bit of a rush to get to the airport, I didn't actually record this day, apart from this section on the plane. So I've got some concealer over the bruise a little bit, but the swelling's gone quite a lot down, and I can't remember here if it's day 5 or if it was day 4. Well, this is what happens when you get up really early. Anyway. Okay, I'm back home now. I don't know if you can see properly with this light. Bruise has gone a bit more yellow. Yesterday I couldn't really show you properly because I was on the plane, and I'd put some concealer on, and one of the stickers came off. Managed to stick it back on anyway. So this is Saturday, so that's 6 days. Anyway, see what it looks like tomorrow. The swelling's gone down quite a lot. The bruising's clearing up quite a bit. Doesn't look too bad. Can't wait till tomorrow to see what's underneath. But it's not annoying. These strips aren't annoying or anything, or itchy. Again, still no pain. So, see what it looks like tomorrow when I take the steri strips off. Okay, so this is day 7. So 1 week after I've had the operation. I've took the strips off, and obviously I've still got a bit of bruising. I'm not sure if the camera is going to pick up the little scar here. It's kind of on a crease, on a wrinkle, so you're not going to be able to really see it. This little one here is much smaller, but at the moment you can see it more. And both of them feel kind of lumpy. So I've got a sore throat. I don't know if I go like that, you might be able to see that they are swollen, and if you can feel them underneath. Now obviously I don't want to be messing with it too much first couple of weeks, but then once the swelling goes down you can massage them to, you know, soften the scar. That bruising, I'd be happy to cover that up with a bit of concealer, not trying to get any makeup on the scars, but I'm not too bothered over it. So I think it looks okay. So hopefully, I'm trying to get in the light because it's quite dull today. Anyway, that's the progress so far. Probably leave it another week and see after a week what it looks like, and maybe with some makeup on, and you can get a better idea. Okay. Hello. Okay, so today is day 10 after the operation, so this is the kind of the day you can go back to work. I think you can see there's a little tiny bit of bruising, very faint, faded, and I'll try, I think it looks, both sides look a lot better. I'll try and go in closer, get the light better. So I don't know if the camera's going to pick it up, but it's kind of a little bit of a lump by each of the scars. So this scar is kind of going into the lines. You can't, I don't think you can hardly see it. And then it's still swollen, and they're kind of like a lump. Now these across the top, they were like a complete lump, a big long sausage lump. But now you can't feel them. So after a couple of weeks you can do some sort of massaging to soften the scars. But I'm going to put some makeup on now. So I'll do the bit with the makeup on at the beginning for the intro of the video. But yeah, it takes apparently 2 months for the, you know, total final results to be seen. But after 10 days, I'm quite happy with that. And it looks a lot better. And just hopefully this is a little problem area of fat here. But anyway, I'll leave the details of the surgeon and the clinic in the description box if you're interested. I would highly recommend. I'll write the name of the guy that I recommend who uses anaesthetic, because I do much prefer that. And thanks for watching, and have a nice day.